and safe passage agreed by both parties to ensure the security of access routes. Let me be clear. There can be no justification for Hamas's horrific attacks on Israel. I understand the grief, the anger, and the fear of the Israeli people. I also understand the grief, the anger, and the fear of the Palestinian people. WHO continues to call on Hamas to release the hostages it took, many of whom need urgent medical attention. We continue to call on Israel to restore supplies of electricity, water, and fuel. We continue to call on both sides to abide by their obligations under international humanitarian law. And we call on who can de-escalate this conflict rather than inflame it. With the world's attention is focused on Gaza and Israel, we're continuing to remind the world that we cannot forget Sudan. Since the conflict erupted in April, almost 6 million people have been displaced, including 4.6 million within Sudan. Combined with the more than 3 million people who were already displaced before the war, Sudan now has one of the largest numbers of internally displaced persons in the world. The already fragile health system is buckling under the load of injuries, outbreaks, malnutrition, and untreated cases of diabetes, cancer, and cardiovascular, kidney, and respiratory diseases. In addition to measles, rubella, malaria, and dengue, outbreaks of cholera have been declared in 3 states. WHO is preparing to support cholera vaccination campaigns. More than 70% of health facilities in conflict hotspots are non-functional in conflict hotspots and in areas not directly affected by the conflict. Health facilities are overwhelmed with patients. Critical services have been discontinued in many areas, including for maternal and child care, severe acute malnutrition, and treatment of non-communicable diseases. Meanwhile, the health system itself continues to be attacked. So far, WHO has verified 60 attacks on healthcare since the start of the conflict, including the occupation of a pediatric center in Niala in South Darfur last week. We're pleased that the hospital staff have been released unharmed, but the pediatric center was looted and has had to suspend its operations. I thank all health workers in Sudan, most of whom have not been paid in 6 months, but continue to serve in the most difficult context. While talks between the parties to the conflict have resumed in Saudi Arabia, there is no sign of improvement on the ground. We call on the parties to implement the commitments they made in May this year. The late Kofi Annan said that suffering anywhere concerns people everywhere. The suffering of civilians in the occupied Palestinian territory, Israel and Sudan, and in so many other crises must concern all of us. WHO is doing everything it can to alleviate suffering in all of these places. But in each case, the ultimate solution is one thing we can't provide: peace. Christian, back to you.
Thank you very much, Dr. Tedros. And with this, we're opening the line for questions and answers now. Let me remind you, in order to get into the queue for questions, please raise your hand with the raise your hand icon. And we'll start with Jennifer Rigby from Reuters. Jen, please go ahead and unmute.
Hello, thank you for taking my question. The question is about Gaza. It's slightly two-part. The first is, do you have any estimate for how many people have died in Gaza outside the bombings from the casualties from bombing? And is there any kind of count of that from the authorities or from WHO? And also, who's the most vulnerable? And then the other question is WHO working with Israel to set up a field hospital in Gaza?
Thank you very much, Jen. And I guess we go to Dr. Rick Peppercorn, the WHO representative in the OPT. Rick.
I didn't get the second part of the question. I think the second part was on field hospitals. Is that correct? Okay, then I'm right. Let me first go to the total number, and I think Dr. Tedros referred already to this staggering number, and unfortunately, we got reports. I mean, the reports unfortunately has been increased. We talk now about 8,805 deaths, of which more than half are women and children, and the injuries over 22,250, including and also for the injuries over half women and children. And displacement was already mentioned of 1.4 million of the 2.1 million Gazans. You asked about field hospitals, and maybe we are definitely, we are currently not working on field hospitals, but maybe if I'm allowed, I could say something about the WHO plans and the WHO operational response plan for the next 3 months. So we are finalizing an operational response plan with an estimated budget of 50 million for the next 3 months. And the focus is first and foremost on supporting existing health facilities. So strengthen and maintain services and reinstitute a trauma pathway. We should realize the health system in Gaza is incredibly resilient, on a breaking point, but resilient. Within this plan, we will focus, of course, on health service delivery, the management of casualties, the re-establishing of a trauma pathway from the point of injury, and also maintaining the continuity of essential health services and the re-establish of referral pathway, primary, secondary, and tertiary levels. We focus on public health intelligence, early warning, disease prevention and control, supplies and logistics, and coordination. This is the core of the WHO operational plan. Then, to supplement that, we will focus on a number of emergency medical teams from outside Gaza to work with those key referral hospitals on certain areas where it's most needed. We also will plan for 2 to 3 additional field hospitals, and ideally 1 in the north and 2 in the south. I want to make a very important point, and people maybe don't realize that. There are approximately 20,000 health workers in Gaza. 20,000 health workers operational in Gaza. There are 7,084 physicians, of which 529 surgeons. There are more than 11,600 nurses, almost 4,000 pharmacists, and 607 midwives. There's lab technicians, etc., etc. There was, for this war, a functioning health system. There are still, from the 36 hospitals, there's 22 hospitals operational, partly operational, I would say. And I think Dr. Tedros, Dr. Tedros already described all the shortages which are, of course, affecting these current hospitals. There's also, when I look at the primary healthcare facilities, currently 26 of the 74 primary healthcare facilities are still partly functioning. Point I want to make, we will have to focus. We are now in an ultra emergency phase. And WHO is doing a lot to address that. I will not focus on that now. But in this humanitarian response, and when you look at health and the health system, we have to focus in supporting and making sure that the existing health systems will be able to deliver. It will be really a bit delusional if you think that with a few EMTs from outside or setting up a few hospitals that we can supply appropriate or even a minimum level of health services for 2.2 million Gazans. For that, and to have, of course, this plan to make sure it's operational, we need ideally a humanitarian ceasefire, but we definitely need safe passages, humanitarian corridors, and a sustained access to the needed supplies. Over to you. Apologies for taking so much time.
Thank you very much, Dr. Pippergan. We go to Dr. Mike Ryan, and maybe if we can also, we have a question about the clarification whether we said 15 or 50, 15 or 50 million for the operational plan, if we have that.
I think 50, but
15.
Yeah.
15, 15. Dr. Ryan, please, for the other part.
50.
Yeah.
5.
Okay, so now, not to confuse everybody, 50 million for the operational plan, 50. Thank you, Dr. Pippergan. And now to Dr. Mike Ryan, please.
I just want to reinforce the point that Rick made. The best and most effective and most rapid way to save lives is to support the existing system. Rick laid out the numbers to you there. The doctors, the nurses, the pharmacists, the technicians, the porters and everybody else within that system have done remarkable work over the last 3 weeks. They have saved countless lives. They want to continue doing that. The facilities are there, machinery is there, the beds are there, the operating theatres are there. It is the responsibility of all parties to the conflict to allow those hospitals to be resupplied. The international law is clear on this. It's not just about not attacking facilities, it's about protecting facilities, and occupying authorities have a special responsibility to ensure that such facilities are not only protected, but serviced and supplied with the adequate needs for the populations that they serve. The issue of EMTs coming in field hospitals, the best and most effective way to introduce an EMT or a field hospital is to bring it in an association with an existing facility where it adds to the number of beds, it adds specialist capability, it allows exhausted surgeons and others to rest while others take on the role. Putting field hospitals far away from population centres, unsupported by the local infrastructure, is not the best way. It takes a long time. And secondly, right now, we have no deconfliction effectively operating. There is no humanitarian access, and anyone out there that says we've got humanitarian access, it is not true. Our supplies are being delivered in a way that I haven't seen in the past. It has been almost impossible to set up appropriate notification, acknowledgement and deconfliction measures in this particular conflict. So getting trucks over the border is one thing. Getting them to the places in which they are needed is another. And that has not been facilitated, that has not been supported. In fact, if anything, quite the opposite. So there is a huge gap between the rhetoric of some and the actual reality for our health workers on the ground and our staff on the ground. That needs to change. Because, quite frankly, I'm sick of hearing all of these reassurances that don't actually exist on the ground for the people we work with. Our staff are operating under duress at the risk of their lives to help ordinary civilians working in and bringing supplies to hospitals. How are we going to bring in field hospitals with further international workers whom we can't even guarantee the basic safety of the staff we have on the ground now? This is unconscionable. This is unthinkable. And I've operated in many different crises in my time, many different situations. And we have never found it as difficult to establish the basic rules of engagement that would allow us to act in a proper humanitarian fashion with minimum guarantees of safety to our staff and to our partners. So the rules of this have got to change. If the international community want WHO and others to bring international staff at international field hospitals into Gaza, they must be able to guarantee their safety, and the occupying power must do likewise. There is no other way to do this. But as Rick said, the best way to do this is to support the existing system. But we will not be instrumentalized in this. We will not become a party to this. We are doctors, we are nurses, we are pharmacists, we are lab technicians, we are porters, we are drivers. Our job is to save lives. That is our only job.
Thank you so much. With this, to the next question, it goes to Ashley Furlong from Politico. Ashley, please unmute.
Hi, thanks for taking my question. I wanted to know if you have the numbers for how many injured have been able to cross into Egypt, and possibly also if you could try to set out how health workers decide who is transported, and how you sort of triage those patients. It's obviously an impossible decision, and I wondered if there's any the WHO has any sort of guidance on that. Thank you.
Thank you very much, Ashley. And for the first part, we start with Dr. Nima Al-Kassir. She's the WHO representative in Egypt. Nima, please go ahead.
Good afternoon, good evening, and good morning. I would like to thank for this opportunity to answer your question directly. There has been a discussion on the most needed for in terms of trauma and medical evacuation for people who need surgery, the burns, the orthopedic, and at the same time, people who are critical in terms of cardiac problems or thoracic injuries. This is one. Regarding the safe access, I would like to echo what Dr. Ryan said, and also Director General. The movement of the patients has not been easy yesterday. We have the total number 46 that arrived. The hospitals, they were distributed between two main hospitals in North Sinai. And at the same time, we know that they have been accompanied by 36 family members. Some of them have been only by one or a couple of two. The decision on who should be coming in and at the same time has been a consensus between several parties, as we understand, especially between the Ministry of Health in the Palestinian territory and Ministry of Health in Egypt. This is the latest that we have. One of the critical aspects that there has been so many, more like 365 international, some people call dual, some of them are international, that yesterday have arrived and they have been safely checked at the border and passed. 35 children who were given their immunization at the border polio because of the fear. This is just quickly to answer this question. However, the concern is the movement has not been as easy, and already Dr. Mike Ryan said, is not as easy as we think. You just open the door and the movement has happened. It started from 11 o'clock in the morning until 10 o'clock at night, and it was trickling. And at the same time, very slow, as I understand. Now that I'm talking with you, I have one of the WHO colleagues from country office at the border since 11 o'clock in the morning, and he said only 3 UN Italian passed, and it was they were taken by their embassies and left. No patient yet. Ministry was expecting patients since morning to come through, and this shows the complexity allowing safe passage, humanitarian access, more importantly, ceasefire. There is a fear of movement by the patients, by their families. Very well put by Dr. Tedros and by Dr. Mike Ryan. If the children and critical care patients are on machineries to keep them alive, with this movement, they are being put at risk.
Thanks so much, Dr. Kassir, and to Dr. Mike Ryan, please.
I just want to add a note of thanks, and Dr. Tedros mentioned this, but particularly to the Ministry of Health in Egypt and to His Excellency the Minister of Health, Dr. Khalid Abdul Ghaffar, because the work that's been done in Egypt over the last number of weeks in terms of medical evacuation preparedness has been truly state-of-the-art. While I was in Al Arish with Dr. Safan, the head of the hospital's directorate, we were able to, with Naima, who's just spoken so wonderfully, We were able to visit the Al Arish Hospital. We were able to visit the ambulance teams. There are 65 ambulances on standby with full resuscitation capability. There are 13 emergency physicians assigned to those ambulances for the most difficult cases. Al Arish Hospital has full resuscitation capability, 30 ICU beds, 6 pediatric intensive care beds, and also has Egypt has brought a number of specialist surgical teams in to work in that hospital, including burns, thoracic surgery, reconstructive surgery, plastic surgery, etc. There is a very intricate and well-worked secondary layer of hospitals that have been identified to take patients on further referral, and the Ministry of Health have also built a stabilisation and triage unit at the Rafah border. All the preparations are there on site. On the Egyptian side, it is in place. It is highly professional, but as Nima has outlined, the problem is getting safe passage for very scared patients and others in moving towards that border. Again, reflecting the terrible complexity of the situation on the ground in Gaza.
Thank you very much, both. Next question goes to Ari Daniel from NPR. Ari, please go ahead and unmute.
Yes, thank you so much. I guess my question is around a report that the Foundation for Defense of Democracies put out, and they said that there's concern that Al-Shifa Hospital, which is the largest in Gaza, is, according to credible reports, a Hamas base of military operations. And I was just wondering on the WHO's perspective around potentially disentangling the critical need for care in these hospitals and the potential complications of them being used as a base for military operations. And secondly, if there's time, I'm wondering about is there what sort of support's being offered for the mental health side of things in Gaza? Thank you.
Thank you very much, Ari. Very different questions, and we'll start with Dr. Ryan on the Al-Shifa first.
Yes, the reality on the ground at Al-Shifa and other hospitals is that we have thousands of health workers, thousands of patients, probably hundreds of thousands of civilians sheltering at these multiple facilities, particularly all over, but in the north now where they're effectively cut off from any assistance. The rules are clear on this. Healthcare must be protected. We have no information. I know what's going on above the ground. We know what's going on above the ground. We deal with the doctors, the nurses, and the administrators at that hospital and all of those hospitals. And they're crammed full of patients, ongoing operations, intensive care, and much, much else. And in that context, we have no information on what may be happening elsewhere or underneath these facilities. That's not information we would have. It's not information we could verify. The misuse of facilities, and Dr. Tedros just outlined an example from Sudan, where the misuse of facilities for military purposes is equally outlawed under international law. The difficulty here is separating the needs of 50,000 people, for example, at Al-Shifa Hospital, civilians, doctors, patients, and others. We have no independent verification whatsoever of any of the information that you refer to. And in this situation where such an eventuality occurs, again, it is the responsibility of the occupying power to not only agree with the local health authorities on an evacuation, but then if that does happen, that has to be fully facilitated, fully supported logistically, and those patients, those doctors need to have a place of safety to go where the patients can receive an adequate and similar amount of care. None of those criteria are met. Those patients cannot be moved. Those doctors and nurses will not leave their patients. And all we know is that is the situation above the ground in those facilities, and particularly at Al-Shifa. We have no knowledge of anything else to which you speak, and no evidence, likewise, that assertion is true. There's lots of misinformation and disinformation in war. We're all subject to it. We're all victims of it. All we know is that we are supporting the thousands and thousands of patients, civilians, and health workers who continue to try and deliver life-saving health care in hospital facilities all over Gaza.
Thank you very much to Ryan. And for the question about the mental health facilities or options, we'll try and go with Dr. Rick Peppercorn from the Jerusalem office for OPT.
Yeah, thank you very much. I want to stress, first of all, mental health, psychosocial support is possibly, and specifically in the occupied Palestinian territory, is one of the biggest needs, and specifically when you look at Gaza, but also apply for the West Bank, East Jerusalem, etc. The many escalations, crises, wars they've gone through, the needs is always been tremendous, and currently the mental, there is what I know, there's actually one specific hospital for mental health patients, which is still partly functional, but that's just a very small part of that. WHO, in the past, we always have been supporting the whole area of mental health and psychosocial support, and as to strengthen mental health and psychosocial support in primary healthcare and creating referral pathways, etc., at all levels. And we continue to do that. Actually, we were just starting with a new grant when this all happened. So we would focus on this on this again. At the moment, we talk, of course, about the mental health, psychosocial needs for many in Israel, and an enormous amount, I think, everyone in Gaza. Just yesterday, I just want to read, we had an all-staff meeting with my teams in Gaza, and a lot of people were actually online. It was, of course, a very, as you can imagine, a very trying and emotional meeting. Some of my staff is incredible. I think they're all incredible, but some of them are still fully operational, risking their lives to make sure that essential supplies and medical supplies go to the hospitals and health facilities, to PRCS, to UNRWA facilities where it's most needed. WHO delivered already three times. Both to facilities in the north, facilities in the south, with my staff risking their lives to do that. But I can tell you that, and this is about UN staff, and people will argue, oh, they're even a bit more privileged than the other Gazans. There were other many of my staff, they were completely desperate, utterly desperate, and utterly depressed, and no vision about life anymore. Well, this is a group of what a lot of people would call privileged staff. So think about the rest of the Gazans, and the Gazans, I mean, like being under blockade for the last 15 years, going through multiple escalations and wars, etc. So yeah, there's an enormous need, and this is just the population. I'm on direct contact with the health workers, with surgeons at various hospitals. Every day we try to exchange texts, and also my staff in Gaza is doing the same thing, so that we can target the supplies as good as possible, the limited supplies as Dr. Tedros were referring to, and many more lined up. And we, of course, get also very disconcerting information about them, their mental health state, of the health of the health workers. So yeah, this is one of the top priorities, and also in our 3 months plan is one of the key topics as well to be addressed. Over to you.
Thank you so very much, Dr. Peppercorn. For this, we also need to go to Dr. Michel Thirin, who's our special representative in Israel. I'm sure he has a lot to add here. Over to you.
Thank you, Christian. On this side, it's a whole shadow of trauma that is spreading across the countries. The survivors, the family of hostages, the witnesses of atrocities, the displaced population, the hosting communities of those displaced people and survivors. I would even say the decision makers, the whole country is plunged in a night of trauma, and the trauma spreads a bit like a virus. There is gradient of trauma with people that are linked together. There are people who stay too long in contact with stories of others. It's really an issue that must be stopped. The Ministry of Health has insisted on the urgency to restore a nationwide mental health resilience. And we have been discussing this the whole day yesterday with health authorities in the presence of Dr. Hans Kluge, who came here also to pay sympathy to those people who are traumatized. I think there is an urgent mental health collapse here in Israel, and it will be urgently addressed, and we are working on that on this side.
Thank you very much, Dr. Thierry, and thanks to all of you. A very grim picture you're painting there. Next question goes to Gabriela Sotomayor from Progresso. Gabriela, please go ahead and unmute.
Yes, thank you very much, Christian. I know that Gaza is a very important issue, but I have a question on Acapulco, Mexico. So on Wednesday, October 25th, a Category 5 hurricane left the port of Acapulco devastated. Nearly 1 million people live there, with 80% of all homes severely damaged. Severe damage is also present in the hospitals. There's still no access to water, food, medicines, electricity, and fuel is scarce. With the heat and bodies still under the rubble, this could lead to disease outbreaks such as cholera or dengue. The number of deaths are at this moment 46, but a lot of people are looking for their loved ones. So my question is whether the government of Mexico has requested your assistance or your expertise in managing these disasters, or do you have any assessment of the state of the hospitals in Acapulco? Thank you so much. Thank you for taking my question.
Thank you very much, Gabriela. You're right. This is easy to forget in the current crisis. I'm not sure we have anyone here today who could talk about this. Maybe Dr. Ryan can.
No, we will come back to you on this. Dr. Ciro Ugarte is our regional emergencies director, and I know that our team in the Pan American Health Organization, the Americans regional office for WHO, are in close contact with the authorities in Mexico and offering assistance. So I would have to update you later on the specifics of what assistance has been requested and what can be provided. But again, our condolences and our hearts go out to people caught in these rapid onset natural disasters, which are becoming increasingly more unpredictable, increasingly more impactful, and they destroy lives all over the world. Climate change is here, the emergency is now, and many people around the world are paying the price for our climate inaction. Thank you.
Yeah, thanks so much, Dr. Ryan. And as we said, we'll connect you afterwards. Please get in touch. Next question, I think it's a follow-up, goes to Jen Rigby, and I have a sense we forgot a part of your question before, so please go ahead and ask, Jen. Not sure you're hearing us. In case not, but then let me ask what I think we forgot. I think we forgot the percentage of other diseases, non-conflict related injuries and diseases in Gaza, if we have figures about that. Not sure we have. Perfect. Dr. Teresa Zakaria, the incident manager, please.
Thank you very much for this question. So I'll have to be honest, I don't have precise numbers for this. And I think this is where it's really important to understand that we need to go beyond these figures. They're an indication as to how bad the situation is on the ground. And people may be dying because of complicated heart disease, but why does that person die in the end? It's because the person cannot access hospitals. Why? Because perhaps their neighborhoods was bombed, the road leading to the hospital was bombed. And so as such, it is unfair and it is not logic at this point to actually attribute the cause of death, whether it's been directly linked to bombardment or not. What we know for sure is that the population in Gaza are extremely suffering. And we see that just with the caseload, the occupancy of all hospitals inside the entire strip. And that is extremely important, and that is clear sign for us too that we need to do something about it. And yes, thousands of patients are already in hospitals. Beyond available beds, hospitals are putting in place makeup beds and treatment options as well for people, but they are really at the verge of collapsing, and that is extremely important to address. We just cannot allow the situation to go on for even another minute. Thank you.
Thanks so much, Teresa, and I think Dr. Rick Peppercorn also has his hand up.
Yeah. Well, first of all, let me provide some facts. We know, for example, there's 1,000 patients in need for kidney dialysis. We know there's 130 premature babies in incubators. We know on average, there's another every year 2,000 cancer patients, which of course are all at risk. We also know that pre-conflict, that on average 100 patients per day, they would actually be referred out of Gaza to East Jerusalem or the West Bank for their specialized healthcare. 100 patients per day. 1 in 4 is a child. Most of them are oncology related. That's the biggest group. But of course, there's also specialization. So yes, of course, this war, this conflict has an enormous impact. There's another 350,000 estimated people who have non-communicable diseases, think diabetes, cardiovascular diseases, of course, cancer, oncology, etc., which are in need to get their insulin, etc., etc. So yeah, we definitely have some facts for that. And what we currently see, because I think there was also a question related to infections, etc. Well, in the shelters, we try to, together with in all the UNRWA shelters and the makeshift shelters, we try to, with UNRWA, to get a good assessment. We see a lot more acute respiratory infections among children. We see, of course, much more diarrhea, and we see skin diseases, etc. The water sanitation in a number of these shelters is really problematic. So we really have to be able to better monitor for outbreaks and be ready for response. Over to you.
Thank you very much. Also, Dr. Peppercorn again. We're coming to the hour, but I would like to give a last round of opportunity for our guests online here. Maybe we'll start with Dr. Rick Brennan, Regional Emergency Director in the Middle Eastern region, in the Eastern Mediterranean region. Dr. Brennan, over to you.
Yeah, thanks. Thanks very much, Christian. Look, I think that the Director General said it best. The needs in Gaza right now are skyrocketing, while our ability to address those needs are plummeting. You've heard all the statistics from our colleagues. I think we've tried to convey what that's like for an individual mother or child or father on the ground, particularly those crammed in these overcrowded settings now. Over 700,000 people in schools, and overcrowding, difficult to get access to food, water. We hear these dramatic descriptions now of toilets overflowing and the risk of disease spreading. And then that coupled with the constant bombardment, it's just a really toxic mix. So what you've heard from my colleagues is exactly what we need. We need guaranteed access, secure access, protected access to those in need. We need to strengthen the existing health systems. The field hospitals, which we are consistently asked about, they will only address a small proportion of the need. We need the access. We need it guaranteed. We need a major scaling up of the humanitarian assistance and the cross-border operation. And most of all, we need the ceasefire that the Director General has called for. So thanks very much.
Thank you so much, Dr. Brennan. With this, we're coming to the end of it, and thank you all for your participation. Again, we will be sending the audio file and Dr. Tedros' remarks right after the press conference, and the full transcript will then be available later today or tomorrow morning. For any further questions or follow-ups, please write to mediainquiries@who.int. And now we'll go for Dr. Tedros for the closing remarks.
Thank you, Christian, and thank you to the members of the press for joining us today, and see you next time.